It's not going to be the same as what it was before.
No.
I mean, this is the new norm, and try different things. If you can't do them, concentrate on the things you can do.
Hello and welcome to Breathe Strong. I'm your host, Rachel. I'm delighted to welcome you to our penultimate episode, which will be for the end of season one. And today we're going to be talking about side effects of treatment. So the first podcast, we're going to just focus on mesothelioma, hence the reason I only have in the studio with me today Leslie. Hello, Leslie.
Hi, Rachel.
And Doug.
Hi, Rachel.
Hello, Doug. And Doug is flying solo today, so because Barbara's not feeling very well. So just want to say, get well soon, Barbara, and we've missed you today. So today we're looking at side effects of treatment. Now, with mesothelioma, still, unfortunately, we have very limited treatment options for our patients or people living with this cancer. NICE have recently recommended immunotherapy as being the first-line treatment for patients with mesothelioma, with chemotherapy, which was the first-line treatment, now becoming more of a second-line treatment. So we're going to have a look at these true treatments today and look at the side effects associated with each. But I just thought it might be helpful as we think about immunotherapy to actually just go through what is immunotherapy, how's it given, and why do we get the side effects that we see with these treatments. So immunotherapy is quite unique. It's transformed many other types of cancer, such as melanoma and lung cancer, indeed. It works because cancer basically is a normal cell that has gone wrong when it makes new cells. Ordinarily, most cells, when they go wrong, have a suicide mechanism inside, which means that they kill themselves off. They recognize they've gone wrong and they kill themselves off. But with cancer cells, they turn that mechanism off so that the cell doesn't die naturally. It just continues to make more and more rogue cells. In our immune system, we have cells called T cells. They're helper cells. They go around our body and they look for cells that are rogue and they surround them and they get rid of them. Again, with cancer, it has a unique ability to be able to hide itself, almost cloak itself from the immune system. So the immune system will go past that cell and think, oh, that's okay, that's a normal cell, and carry on. The scientists found this mechanism when they were doing lots of research and they developed these drugs, immunotherapy. And what immunotherapy does is it enables your own T cells to recognize cancer and attack it, with the end game being that it kills the cancer cells off and stops more growing. The other way immunotherapy works, and this is the problem, and this is the reason why we have many side effects, is that we have natural brakes on our immune system, and that stops our immune system from attacking us. Unfortunately, one of the things that immunotherapy does is it really boosts your immune system, takes those brakes off completely, which in one hand is good because it's attacking your cancer cells, but on the other hand, not so good because now we've got an immune response going on that then means that we can end up having an attack on our own bodies inside. So you'll see many side effects that are related to that problem, such as hepatitis, poor hypothyroidism, which is where your thyroid gland is reduced in its function, arthritis, colitis, which is a severe diarrhea due to inflammation of our bowel, hepatitis, which is inflammation of our liver, myocarditis, which is inflammation of the lining of our heart, and pneumonitis, which is inflammation of the lung tissue. These side effects can come either mild or they can be quite severe. We don't know who's going to get side effects, or, we can work out for some of the side effects when they may come on, but again, some patients will have worse side effects and they may happen after just one treatment, whereas other people may go on to have 6, 7 treatments with no side effects and then suddenly get side effects. So immunotherapy is given via the vein. It's given through an infusion, and on day one you have two immunotherapy drugs, and then 21 days later you have one of the immunotherapy drugs, and then you repeat that cycle. You'll have a CT scan to check that the drugs are doing what they should be doing. And so you carry on, and you can carry on for up to 2 years if the drugs are having an effect and it's not causing you um, unreasonable side effects. We think that after 2 years, although we are still looking at this and the scientists are researching this, that the immune system is programmed then to recognize the cancer cells and get rid of them. And so after 2 years, there are a group of patients now who are living with their mesothelioma, not on treatment and doing well, which is amazing. Um, but today we're going to really focus on having this treatment, what it's like to have this treatment, and side effects of this treatment, how we cope with them. So, with that in mind, I'm welcoming Leslie and Doug. They both had immunotherapy, both with differing experiences. So, I'm just going to open up to both of you and say, what was it like for you having immunotherapy? And what was the impact on your life? And maybe, Leslie, we'll start with you on that.
Okay. So I was offered immunotherapy. Actually, I was actually asked to go on a clinical trial when I was first diagnosed, but I ended up having the control arm, which meant I'd have the standardized immunotherapy treatment. And this was July 2024. I had my first infusion, and thought, yeah, great. That was sort of painless. Nothing wrong with that. But I got home, and right away, my temperature started to go up, and now even when I've had the flu or had a cold in the past, my temperature's always sort of stayed around the 36.4 or 5 marker, and it shot right up to 30 in the 37.56, and I kept seeing it going up, and I thought, okay,
Right.
this isn't right. So I sort of waited 24 hours. Um, gave the 24-hour helpline a call, and they said just to keep an eye on it. And then, literally within a couple of days, it got quite bad. So I was pulled into the oncology sort of day unit to be checked, have my bloods taken, and then they they started me, actually this by the Monday, my hands and my feet had started to seize up.
Right. Okay.
And so I was a little bit concerned about what was
Yeah,
going on.
absolutely.
I actually had a friend staying with me at the time, and so she came with me to the day unit. And they couldn't figure out what was going on because I'd literally only just had the one treatment. And so they actually started me on a very, very high dose. Did they start me on? I can't remember. I can't remember now whether they started me on the steroids on that day.
Right.
But they sort of checked me, and then I got sent home again. And then things started to get worse as the days went on.
Okay.
I think I had my first treatment July 10th, 11th, or 12th, around that time. And it was actually my birthday on July the 15th. And I remember being back in the oncology day unit on my birthday. And within 2 days, I was actually admitted to hospital.
Right.
And I look back now. My sort of CNS nurse at the hospital, she came up to me in the hospital bed and took a photo for my chart, which is what Guy's Hospital uses, so you can log all your appointments, etc. And I look back at that photo now, and I realise now how poorly I actually
Really?
was.
Yeah. Yeah.
It just doesn't even look like me.
Right.
And that's when I was put on a very, very high dosage of steroids, which we all know. When that happens, steroids can make you feel pretty wonderful when you first start taking them.
Mhm.
And obviously, they needed to bring the level down, but they decided to stop my treatment right away. And it wasn't until like a few weeks later I was told that I had got grade 4 hepatitis.
Oh, wow. Okay. Gosh.
And so, yeah, I didn't feel poorly, But I was told that I actually was very,
Very
very,
poorly.
very poorly. But also with that came I also got inflammatory arthritis as well. So it started off in the hands and feet, and we sort of managed that with the steroids, and then basically they had to stop my immunotherapy right away, and we had to get my is it the ALT levels down, I think. Yeah, because they were sky high. They had to come down to a certain level before they would even think about maybe starting me on treatment again. I mean, there was a possibility that they weren't even that I wasn't going to be able to have any more
Okay.
immunotherapy.
And during that time, so in those early days,
Yeah.
I mean, great that you called the acute oncology.
Yeah.
I mean, we would always advocate that, and
Yeah.
that was amazing
yeah.
that you had that support there.
Yes.
But what was that like? Were you sort of? What you said? Oh, when I look back at the photo,
Yeah.
I was like, oh my golly, I was really
Yeah.
poorly. But at the time, were you a bit like, with everything that was happening, was it quite overwhelming? So you didn't really process what was happening, if that makes sense.
Exactly that. I think for me, it was, I guess, because it was my first, the panic was that on my first treatment, it's not working. And I think what was going on in my head was the fact that I might not be allowed to have treatment. And of course, I'd been down the rabbit hole of being told you've got mesothelioma. And so when you look online about mesothelioma, there's never a good story. But
No.
and so I was thinking, oh my goodness, is that it? That's it? My ticket's going to be up within
Right.
however many months. And so I did everything in my power to try and get out and walk as much as I can. The steroids did help with that. Eating really, really healthily, and I managed to get my levels down within. It took a good month and a half. So they were able to. My lovely oncologist, he presented it to the board that I'd worked really, really well, and that if we take away one of the immunotherapy drugs, maybe we can just try her on.
Yes.
Try her with one.
Yes.
Which is what we did in the end. And so
Right.
I did that at the end of September. I started the immunotherapy again.
With just the one drug.
Just the one drug, yes.
And I think that lots of patients don't realise that we know that one of the drugs is very toxic, and is the culprit for a lot of the side effects. But once you've had one dose of that drug, you can talk to your oncologist. If it's not suiting you, don't suffer in silence, I would say. Talk to your oncologist and say, look, that under NICE, you can actually drop that drug and carry on the one drug. And we have clinical trials that say that one drug is effective and does work, and may be more tolerable. So always go back and talk to your oncologist if you're struggling.
I mean, I can say with that one treatment. I mean, I think I can't remember when it was. I had my CT. Because I was still on. Although I was on the trial, they dropped me from the trial, obviously, because I had such bad toxicity, but they were still giving me regular 6-weekly CT scans because they wanted to collect the data from me. And from those CT scans, it showed that the nodules of the disease, I think they were measuring about 5.5 centimetres to start with when I first got diagnosed. They went down to 3.5 centimetres.
Wow, so you had a response.
So I had a really, really good response. Although, it wasn't doing me any good. The other things weren't doing me very good. So in that respect, great. I thought, great, this is fine.
This
I can
has been
deal
worth
with
it almost.
Yes, absolutely.
Yeah.
So yes, obviously then I started on the one drug, and everything.
Yeah.
Everything seemed to be fine for a while, and we were and I actually even started to see a personal trainer again,
Right.
which is sort of in the November of 2024.
Okay.
And then literally within just right before Christmas, the joint pain started to come back again.
Right.
And that's when my body just started to become riddled with the they call it treatment induced inflammatory rheumatoid arthritis.
Wow. Okay. Mouthful that.
And I
That's
had
easy for you to say.
I know.
Yeah, I was gonna say, yeah.
And I had
Wow.
that in I think I had it in my feet, my knees, both hands, most of my right arm. I had to walk with a walking stick, and with that comes all sorts of because of being a very active person originally. With that comes the depression and all of
Yeah.
those sorts of things, and the pain. I mean, I was on
Gosh.
the maximum painkiller drugs that you can take. So
Gosh. Very hard.
yeah,
Very
it was
hard.
a very, very difficult time. So yes, yeah, I mean, in the end, they with persistence, because you have to be persistent with your oncology team. I requested to be referred to rheumatology as well because
Right.
I didn't want to be on steroids for the
No.
rest of my life.
No.
You know?
No. And I think that's another thing to say is that with immunotherapy, there are hospitals that have put together an immunotherapy team because we know of these side effects. And actually, as oncologists, they're not rheumatologists, they're not endocrinologists, they're not dermatologists, or cardiologists. So some hospitals have built together an immunotherapy team which draws on all of these other experts to treat side effects. And just coming over to you, Doug, because I think your experience was quite different. What happened with you when you first started treatment with immunotherapy?
The immunotherapy, yeah. I mean, I had radiotherapy before that, 10
Right.
sessions,
Okay.
which was
And
fine.
was that for
It
pain?
was, yeah.
Yeah. And did that help? What was
After
that
about
like?
the second or third session.
Oh,
Yeah,
okay. Okay.
it
So
really
quite
did.
quick
Oh,
then.
yeah, yeah. And we continued with the 10. And then I started the immunotherapy, which I had the first session. And after a day and a half, I came out in a rash, you know, um, which we reported to the team. And they said, oh, you do get a rash,
Right.
it's one of the side effects, unfortunately. Then I went for the second session, and more or less straight away, everything just went wrong. The rash was like somebody had been all over me with a Brillo pad.
Oh,
It was
wow.
head to foot, all in between my fingers and my toes,
Oh my
just
goodness.
everywhere. It was a nightmare, really.
And what did the rash look like for people that, maybe about to commence treatment? What did it look like? Was it red?
Yeah,
Did it
red.
have pustules or
No, just
spot?
just a red
Just
spotty
red.
rash.
Oh,
Yeah,
it was
it was. Yeah, no, there was no weeping with them or anything.
okay, but
It was just,
Quite bumpy. Was it quite
it was a
bumpy?
bit bumpy.
Yeah,
Well, still is, but
yeah.
okay, wow.
yeah, and it was horrendous.
Really?
And then about 2 days later, I got really ill. I was in bed, rarely got up,
Oh,
didn't eat. I had oral thrush,
oh gosh.
um, diarrhea, sickness, more or less anything you can get. I had it really.
Wow.
I lost about 2.5 stone in weight.
Bless you.
My
And if I never
God.
see another banana smoothie, it'll be too soon.
Oh, okay, okay. Gosh, so at that point, when you were getting really ill, had you rung the hospital at that
Yep.
point? Yeah.
And I also had an appointment with the oncologist,
Right,
which
okay.
Barbara took me actually in a
Did
wheelchair.
she? Did
And
she?
yeah, well, I couldn't walk. I couldn't, took two of them to bundle me in the car to get me there.
Oh my
And
goodness.
we went in to see the oncologist, and the look on his face, was horrendous, really. And he said, right, that's it. No more treatment for you. Stop right
Oh,
now.
right,
Just,
okay.
and he prescribed all these different things for the thrush and the steroids, obviously. I think I was on about 20 a day to start with,
Mm-hmm.
and things for the diarrhea and the sickness, and creams for the rash
Right.
and what have you. This went on for about 5 or 6 weeks, and I gradually started to get a bit better.
Were you off treatment during that 5 or
Yeah,
6 weeks?
yeah,
Right,
yeah.
okay.
No treatment at all then. I was having the two, obviously, to start with. Um, And gradually, thanks to Barbara, I built up a bit and built up and could actually get up. One of the problems I had was I used to get up in the night to go to the loo, which took me twice as long. Um, but I used to get lost in the bedroom.
Did you?
Yeah, because
Were you disorientated?
yeah, and our ensuite is right next to the stairs.
Oh my
Oh my
goodness! You didn't
goodness.
fall
So
down the stairs, did
no,
you?
luckily, but I used to
Hmm.
get there sometimes, and I had to shout to Barb to wake her up
To get her to come and help
because I didn't
you.
know where I was.
Oh my golly, that's scary.
Yeah,
Very
In
so
your
scary.
own home
yeah, and
to be
we'd lived in
disorientated like
that
that.
bedroom for 30 odd
Yeah,
years
that's really
and
quite odd,
just
isn't
hadn't got a
it?
clue.
No, and thank goodness you had Barbara, because I think sometimes, like with you, Leslie, you were managing this on your own.
Yeah.
Um, it goes to show the importance of just having your support network there.
Definitely. Yeah, without a doubt.
Because
Yeah.
like you were saying, Barbara nursed you better, really, didn't
Oh,
she?
yeah. Yeah, I wouldn't be here if it wasn't for her.
Oh, bless.
Wow,
Yeah.
gosh, that's really powerful.
Mhm.
And then what happened then? So, did you
Well,
gradually start to get better?
yeah. Yeah, I gradually got better. I started to put a little bit of weight on and could move a bit more. Um, where I used to go down, I mean, I couldn't get downstairs on my own. I could get up because I went up on all fours, but she used to take me
Wow.
downstairs in the morning, get me dressed, put me in and out of the bath because I couldn't get in the
Oh
bath.
my gosh.
Um, and lather me up with all these creams which I was given. And I used to sit in the lounge watching the telly or what have you, because it was still sort of winterish. Um, but every time I got up to go to the loo, she made me walk round the dining room table.
Right.
She said, "Because you've got,
Got to
you must
build
move." Yeah.
yourself
And
back
as I
up.
got a bit better, I had to walk round it twice.
Right. Okay.
And then,
Okay.
and then gradually I got out so I could walk down the
Wow.
garden. And it
Gosh.
took about 7 or 8 weeks. And then I went to see the oncologist again.
Mm-hmm.
And he said, "Well, you're well enough now. Your bloods
Yeah.
are okay." So I'm like Leslie. I only went back on one,
Right.
and
Okay.
we know which one is
Yes, we
the
know. Yeah.
problem. Yeah, and here I am.
And I wonder for both of you what that must have been like to go from, a fit, relatively healthy. I know you have
Yeah.
mesothelioma, but your lives were good at that time. You were both very active. To go from that to being almost crippled, well, you
Mm,
were both crippled
mm.
in different ways. Um, I wonder how on earth you managed to cope with that.
You've just got to think that this is the worst bit. It
Yeah.
can't get any worse than this. It's got to start getting better,
Yeah,
which luckily it did.
yeah,
But you've got to work at it.
Yeah.
It's
yeah.
not,
Yeah.
that.
Sorry, it was this.
Oh,
This.
It's all
This.
right.
Sorry.
It's
This.
all right.
they've
We've
gone
dropped the
on the
tissues
dropped
on
the
the floor,
tissues.
so now poor old Leslie. But
Um,
yeah, I think
Yeah, you've got to work at. Like you
yeah,
say, there is no miracle tablet you can take, and
no,
then
No.
you wake up the next morning and you're there.
Yeah.
You
mm,
know,
I mean,
it is hard work,
it is hard work. I
and
remember.
still is, to be
Yeah,
honest. It's not.
it is.
I've been off the treatment, as you know, for 2 years, for
yeah.
over a year now.
And you were saying this morning, Leslie, that things aren't feeling great today.
No,
Really,
they're not. I mean, for me, I think the worst. Day for me last year was I'd gone out with some friends on a Saturday night, and I left early. So I said, look, I'm just not feeling very well. Got home and I went to get up to go to work, go to the toilet in the morning, and my legs buckled underneath me.
oh,
And I obviously I called oncology straight away, and they said, look, if you can hold on for a day and get yourself into the oncology unit, you come in, we'll just check you over and stuff. But I literally I was having to use the wall
Mm,
to ease myself to try. Oh, luckily I'm on the ground floor, so I don't have
right.
any stairs to go down. But I thought I was going to have to sort of bum shuffle to the bathroom just to be able to get to the bathroom. Just holding on to everything. It was horrible. And I was admitted to hospital that time as well. That was when they sent me to rheumatology. But yeah, like I say, I that was when they did the scan, and they discovered that actually it wasn't working. So
right.
I think that was in goodness, must have been May last year. May, yeah,
Okay.
June last year.
Yeah.
They said to me, it's not working anymore. The cancer had started to grow again. So then you kind of automatically thinking, oh goodness, what's going on? But anyway, with that we'll talk about it. But we're talking about obviously the joint pain coming
Yeah,
back.
yeah.
But I was on some drugs which rheumatology had prescribed me, which took a while for them to kick in, but they really started to help me. And by the end of May, I was without my walking stick. I was
Wow.
walking. It
Brilliant.
was great, and it's a form of sort of chemotherapy drug. And
Okay.
yeah, and then they actually, because I was told then that I was going to be put on chemotherapy, we stopped that. But now that I think most drugs are out of my system, I think the joint pain possibly is coming back.
Okay,
Yeah.
okay. And I think that is one thing to say about immunotherapy, that, we are still learning about immunotherapy and drugs and the long-term effects of immunotherapy drugs. But we do know that sometimes, particularly with things like arthritis and even colitis, and some patients have adrenal crisis and have to be regulated very closely. These can be, well, they're life changing, and they are often with you for life. So it's about, thinking. I think maybe as healthcare professionals, we don't really think about that long-term support network for our patients, and how we go about providing that on a long-term basis, so that when you have flare-ups, there's a process in place to support you, really, I
Yes.
suppose.
Yeah. I mean, like my rash, as you know, I've still got a bit of it, but
Have you?
it's only in the last 6 months that I actually got to see a dermatologist,
Right.
which had somebody, referred me before, I probably wouldn't have been half as bad as what I am now.
Right.
Well, that's what the rheumatologist. That's you with the rheumatologist.
Sorry.
Your
The
dermatologist.
dermatologist.
Yeah.
Um,
But often as patients, you don't know to ask for these other.
No, you don't.
You just don't. You
No,
don't know, do you?
which
So
is what you were saying about some hospitals now have got a team,
yeah,
which I think everybody should. Every
everybody
hospital
should
should
have a
have one, and
team.
you
Yeah,
should
we
be able
absolutely should.
the
I agree with
access
that.
to them. Definitely.
Yeah,
I mean,
yeah,
as you know now, I've got arthritis in the
yeah.
hand. I'm waiting to get that seen to, but
Mm.
Well, so with my hands, because of the arthritis, I've ended up last March last year. I ended up where my thumb dropped, and as it transpired, I've literally only now, like in the last couple of months, had the ultrasound for that problem. It's taken a
Wow.
year for that
Oh my
referral to
goodness!
come through.
Really?
Yeah, and they discovered that I've ruptured my thumb, which I mean I'm allowed to have surgery on it, but that's like 3 months I wouldn't be able to drive, which means I'll be isolated. I'd have to take more time off work. Someone would have to look after me for a couple of weeks, and I can't expect someone to take 2 weeks off to come and look after me. And I've managed for a year without a thumb. So I've just said, and then they've said it won't get any worse, like, as in
Okay.
terms of
So you're just
being
going to
able to
live with
use.
it.
For now, I'm gonna park that one and
Mm.
live with it, and
Mm.
unless like it gets really, really painful. But I mean, I'm hoping that certain drugs will help with it. But if not, I'm going to ask to be referred back to rheumatology
Yeah,
again, because
absolutely.
those drugs were working. And I think, I'd rather not. I mean, steroids are fantastic. They are fantastic for everything, and they really, really have helped me throughout. But as a long-term solution, I'd rather not be on it
Yeah,
because,
because they carry their own side effects
Yeah,
in
they
themselves,
do.
steroids,
they
don't they?
Yeah,
absolutely
So,
do.
yeah.
yeah.
I mean, the way steroids work, and the reason we treat people with steroids when they have these side effects, is that steroids put the brakes back on. So they help damp down your immune system, which is great, because then they help relieve the side effects, but then they also have their own
Yeah.
side effects for long
I feel
term.
like it's kind of putting a band-aid over the problem and not
Yeah.
dealing with the problem properly. So, I mean, yeah, like I say, the drugs that I was prescribed from rheumatology were amazing. They were helping, and meant that I could start to live my life a little bit more normally again. And so, we're hoping we don't have to go down that route again.
Yeah.
But I have noticed like my elbows lock into place,
Right.
and it's quite you have to kind of turn your arm around to be able to unlock it and straighten them again.
Right.
And like today, my grip of my right hand is quite poor, where I can't lift anything really. So I mean, you're saying you've got the arthritis in your hand, and with it being my dominant hand as well, it's quite
That's
hard
what
to
I
train
said.
your
Very
train your
tricky.
left hand to do
because-
everything.
Yeah, exactly.
So yeah,
yeah, very difficult. And I wonder, for those people who are about to start or, who are just starting, I wonder if we should perhaps have more counselling for our patients on starting these treatments. I think one of my concerns is that some oncologists go the other way. So they get so caught up with the fear of these side effects because they are debilitating, aren't
Yeah.
they, on
Yeah,
your life,
definitely.
yeah,
that they then almost terrify people
yeah.
and then say, well, we don't even know if it's going to have that much effect on you. It might give you just a couple of months extra life. And then patients are saying, oh, no, I don't want it then. I don't want it. But actually, I mean, one of the good, we'll come on to some good news because there
Yeah.
is good news
Yeah.
for both of you,
Yeah.
is that so when these drugs work, I mean, they really work and they can be really helpful and almost life-changing. And I just wonder if we had a better multidisciplinary, so, with your physio, your OT, your dietitian, lung nurse, and your oncologist before you start having some sort of counselling about side effects.
Yeah.
Yeah, because I
Whether,
mean, they can frighten the daylights out of you.
Yeah, I can imagine getting
Yeah.
up
When
in
you-
the night and not knowing where you are.
Yeah. Especially, well, I mean, I live on my own, and I think, and also I've found, I don't know whether it's because I'm quite an independent person and they see me as being quite, I mean, and I even get this from sort of all of the doctors or the oncologists and nurses in the hospital. Like, I'm always told how well I'm looking,
Yeah.
and sometimes it can be quite frustrating because,
Yeah.
and I read an article this week and the lady explained it quite well actually. When someone says you look really, really well, they don't realise how long it's taking you to get yourself ready to get out the door, to be able to go and do the things that you have to do.
Yeah.
You have to completely change your life around. I went to an event a couple of weeks ago and is one that I like to go to, and dancing, and it was great and I managed to do all of that, but it meant that I had to rest all day to be able to go and actually just have a couple of hours out in the evening.
Right.
So
And I I can remember another patient of mine saying that he found that really quite almost offensive when people said, well, you look well, because he said, what I look like doesn't say what I'm like
What you
on the
feel like.
inside. Yeah,
Absolutely.
on the inside.
Absolutely.
That is
And you're
correct.
almost like dismissing.
yeah.
It's maybe we say these things to make ourselves feel better.
I think so. I think I've said this in the past. It makes you feel better if you've told someone they're looking really, really well. But actually, if someone you change the narrative a little bit and just say, well, actually, but how are you feeling? You look
Yes.
good, but how are you actually
Yes.
feeling? I think that's the way we should phrase it, I think.
Yeah, they're two different things sometimes.
Yes, they definitely
Yeah,
are.
I agree. I agree with you. And it was interesting that the article that Leslie's talking about, so for those of you that can access The Guardian, there was an amazing lady who spoke very candidly about her experience of living with stage 4 lung cancer. And it was just absolutely brilliant. It was quite a long article, but it's so worth reading. So if you can get The Guardian and go and look her up, I can't remember her name now, but we'll try and get it and put it on the Breathe Strong site, or speak to one of the charities, hashtag or EGFR Positive UK, for the link, because it was well worth a read.
Definitely well worth a read. I've actually forwarded it to some of my friends because they kind of ask me how I'm feeling, and I say have a read of this, because it's really hard for me to put into words sometimes how I'm feeling, because I'm not like Doug. I'm not having active treatment at the moment, but I still do have cancer,
Yes,
so
exactly.
Yeah.
Exactly.
and so she explains it really, really well in what it's called, like the long middle, or
Right, okay.
and which is really good. Like people, when you've when you've beaten cancer or in remission, everyone's cheering you on.
Yeah.
And obviously when someone sadly passes away, you are mourned. But nobody knows what to deal with when you're in the middle.
When you're
Yeah.
halfway there.
Halfway there. Yeah, exactly.
Yeah. Yeah, and
Yeah.
I think that's a really pertinent point you picked out there, Leslie, that we cheer everyone on and it's big celebrations. Oh, it's cured, you're in remission, rah, rah, rah. But with lung cancer and mesothelioma, we don't get that.
No.
So we get like that long drawn out period, hopefully long drawn out period where people are they're living with the cancer, but the cancer's still there. And so what have we got to celebrate? What should we be celebrating?
Yeah, exactly. Because you still go through every 12 weeks you're anxious because you've got that scan.
Yeah.
You don't know whether it's going to come back, or then it's all fine again. So you got another 12 weeks, and so it can be obviously quite exhausting for family and friends around you because they don't know how to be around you, I guess. you know.
Yeah.
I mean,
Yeah.
you've got Barbara, who's amazing. So
Yeah.
Definitely.
But hopefully, I think that's one of the reasons I really, really wanted to do Breathe Strong was because I wanted people not to feel like that and be on their own and to have a place where they can come and be safe and just say it how it is and share how they're feeling.
This podcast is amazing. It's really helped me, really helped me.
Good. And then you were saying, Leslie, that when after immunotherapy, you actually then went on and had chemotherapy. Is that right?
I had chemotherapy. I was obviously, when I was told that my cancer was starting to grow again, they said, minimal, but when you're told your cancer's starting to grow, obviously, you go and I actually didn't have anyone with me at the time as well. I have been taking people to my appointments, but this particular time I didn't, and I sort of left there, burst into tears, and you just sort of worrying then, okay, what does that mean for me?
Exactly.
But my oncologist said, look, it's we want to try you on chemotherapy, and obviously gave me all of the information to take home about chemotherapy. And again, that's being told you're going to start chemotherapy. It's quite scary.
Yeah,
because
I agree.
I guess you read about it all the time, especially with someone with cancer. Like, oh my goodness, am I going to lose my hair?
Yeah.
Am I gonna, I've been.
I don't have much trouble with that.
Well, Doug doesn't need to worry about that, bless him.
It's
But
but it is one of those. It's one of those things you automatically
am I
go
going
to.
to lose weight? Am I going to look like
lose
a cancer
weight,
patient?
Exactly. All of those things.
Yeah.
All of those things.
Yeah.
Am I gonna be really, really sick? Because that's like a phobia of mine, being sick.
Yeah. Oh gosh. Yes.
So,
of course. Yeah.
so all of that, I went home and was in complete panic mode for a while. Thankfully, they said, look, go away, have a holiday. You don't, we'll take a month off before we start it,
Okay.
and then we'll go into it. And I I was with the chemotherapy. You're given two drugs, and you're also given a vitamin shot as well, which is amazing. I love those vitamin shots. But I started at the beginning of August, and I pretty much sort of cleared my diary for the whole time. I say cleared my diary, but yeah, it was every 3 weeks I was given the infusions, and it meant that first week I wasn't sick, thankfully. Didn't lose my hair. It shedded a lot. It's a lot thinner than it used to be. But I did. I had extreme nausea for probably about 5 or 6 days.
Okay. And how did you cope with the nausea? What sort of things did you do?
Peppermint tea. Ginger biscuits. My appetite since I've had cancer has just gone weird anyway.
Right.
So
okay.
I'll eat when I felt like it. The smoothies, just smoothies to get the goodness in you. Obviously,
Did you have any taste changes? Because I know that can be quite common.
Yeah, I stopped. I think I went off a few things. Yeah, so I still don't like eating a few things like spicy foods and things like that.
Okay.
Can't eat.
Right.
And even now, sometimes it'll be nice, good the one day. I think it was chicken I had one day. I ate it the one day, and the next day, no, couldn't eat that. basically threw it up.
Oh,
So yeah, and I
okay.
was like, and then
Wow.
that puts you off for a while. But
Yeah.
and that's, that kind of still does happen sometimes. You just the taste just is up and down all the time. Haven't lost the ability to love chocolate though, which is thank goodness.
Good.
So yeah,
Good. But there's
small
silver linings. Silver linings. Yeah.
yeah, yeah. And and I do, and also I do allow myself to have those treats as well. I
Yeah.
think
Well, yeah.
our bodies have gone through a lot
Yes.
with all the treatments,
And it's important to remember, I would say to people when I counsel them about starting treatment, it's important to remember why we're having treatment.
Yeah.
And it's particularly when it's not curative treatment. So it's designed to try and stop the cancer
Yeah.
and improve symptoms. So the overriding strapline, as I say, is quality of life, isn't it? And if
Absolutely.
you
Absolutely.
enjoy a glass of wine,
Absolutely.
if you like some chocolate,
Yeah.
then that's quality of life
Yeah.
to me. And to rob yourself of that makes me think, well, what are we doing this for?
Yeah, I mean, I did stop whilst I was having the chemotherapy. I did stop drinking and stuff. So
Yeah.
I stopped for about 2
but
years.
Right.
but now I'm not having treatment. I do allow myself to have a glass of wine because
Yeah.
it's nice. I don't obviously go out and drink like I used to. But,
No. Well,
you
I
don't-
think naturally we all
naturally,
sort of, as we get older,
as you get older, you can't cope with it.
go with 2 o'clock in the morning down the nightclub.
No, not at all. But
Ah.
but with the chemotherapy, there was a chance you can either have 3 to 4 or 6 cycles of
Yes,
it. So
it's 4 to 6 cycles.
yeah, 4 to 6 cycles. So I had the first few cycles, and I think one of them, my blood, before I had one of my cycles, my bloods weren't great, so I had to delay it by a week. But my blood sorted themselves after a week, and then they had the scan, and the scan was showing that my disease had stabilised, which is
Brilliant.
great.
Yeah.
So I was allowed to have those last few cycles of chemo,
Okay,
which is really, really
okay.
good. And then I had my last cycle at the end of November last year, and then I had the scan after that, sort of at the beginning of January, and it's showing that it has shrunk slightly.
Wow,
So,
fantastic
yeah.
news.
So
Brilliant.
so that's good. I've got a scan coming up soon, so we're a little bit anxious about that
Yeah,
one,
of
but
course,
we'll
of
keep
course.
fingers crossed
Yeah.
that everything's still as it should be.
Good.
Yeah.
And we do see that with some patients where immunotherapy's not really worked, when they start chemotherapy and we're not sure whether the immunotherapy has some effect on the cells, which then makes the chemotherapy more active. And so we are seeing some patients where immunotherapy hasn't really worked, but they go on to chemotherapy and it does work.
Yes.
So
yeah. And
yeah.
I know my oncologist has said to me, like, even if I get the slightest sort of disease progression, they probably would give me chemo again
Okay.
because I coped really, really well
Yeah.
with it. So,
Yeah. Good. And just thinking now where we are now, because I know that, there has been some positivity. I know both Doug and Leslie have had quite horrendous side effects, and that's not the case for everyone in immunotherapy. Some may have mild side effects. But what's life like now? So we've come through treatment, and what's it like now? I know, Doug, you were talking about going away, and just give us a flavour of that. There's light at the end of the tunnel.
Oh yeah, definitely. You've got to keep positive, and do what you want to do. If you want to go on holiday, go on holiday.
Yeah.
Don't matter what the others say.
And are
"Oh, you
you
can't go on
feeling
holiday with that." Well, of course you can. Why can't you?
okay? Yeah,
I
that's
I
good.
just think that just live your life as best you can. It's not going to be the same as what it was before. I
No.
mean, this is the new norm. And try different things. If you can't do them, concentrate on the things you can do.
That's a really
I
good
think
bit of
that's the main
advice.
thing.
Absolutely.
It's no good thinking, oh, I used to be able to do that, and I'd like to do it again. If you can't do it, you can't do it, and that's the end of it, isn't it?
Yeah.
As I say, just
Yeah.
concentrate on things you
Be
can
kind
do.
to yourself.
Yeah,
Yeah, I think it's
Yeah.
sort of
don't beat
living
yourself
for
up because you can't climb a tree.
Yeah.
You know, it's
I could never do that anyway. So
I'm looking at you,
not
don't
gonna
go,
start
climb
now.
a tree,
Yeah.
start a lawnmower.
well, there you go.
But yeah, I think it definitely is sort of living for the now, not for tomorrow, because none of us know what tomorrow is going to bring.
No.
Absolutely.
No, I
and
think
you
it's
know,
just as well we don't.
yeah,
Yeah.
I
Yeah.
think so. And I do. I mean, I said this to someone the other day. I mean, not that we know when our time is up. Nobody knows when that is. But we've kind of been given a rough idea of like I guess having something like mesothelioma or any cancer, incurable cancer, it sort of gives you that, eggs you on to live your life and not think, oh, I must be saving for retirement or must be, doing this, that and the other. And, for me, I want to do as much as I can now whilst I'm still able and mobile. Definitely. I guess my only worry is that, I was at the support group the other day, and there was a lady there that has got she has to have a fluid drained from her lung regularly.
Right.
I don't because I had a pleurodesis, but there is that worry that that you could have fluid building up in your lung
Yeah.
again, and to not be able to swim again, that would really
Yeah.
I would be heartbroken if I couldn't do that. And also maybe to go on those sort of long haul holidays on my own, because
Yes.
I like to do things on my own.
Yeah.
I don't mind, because because not everybody can take the time off that I
No.
can. So
Yeah.
those.
And you actually did achieve that, though, didn't you, Leslie?
Yes.
Because you
Yes.
did go on holiday.
Yes, I went to Mauritius for Christmas, which was amazing. And I'm in the process of trying to organise to go to maybe somewhere in the Caribbean before my next scan results. I want to try and get away. Just it's that kind of fear of, if something isn't great, then I'm going to have to put the halt on all that sort of travel for a while again. Hopefully, not forever, but yeah, get all the holidays in now whilst I can.
Yeah. And I think as we're drawing to a close, our time is coming to an end.
You're talking about the podcast now.
Yeah, definitely the podcast. Yeah, Doug. Yeah, I've not developed crystal ball technique just yet. Give me time, but not yet. What would you say to somebody who was either just starting treatment or about to start treatment, or who may be having side effects of treatment? From both of you, maybe Doug, you want to go first. What would your message be to that person?
If you've got a problem, ask somebody. There's a wealth of people out there like yourself, your oncologist, your nurse specialists. You're the experts. It's no good. Don't look in Dr. Google.
Yeah,
'cause
I was just about to say, don't sort of. Yeah.
Some of it might be all right, but I think most of it you could.
Yeah.
You could
rely on that.
Yeah.
Rely on that 24-hour helpline. It's been my saving grace over the
And-
last couple of years.
like HASAG.
Yeah.
Yeah, and
Whatever
exactly.
problem you've
And
got,
HASAG,
somebody
yeah,
down there
yeah.
will sort it out
Yeah.
for you.
Yeah.
All those horrible forms you have to fill in.
Yeah, that's very true. Yeah.
Don't be
absolutely.
afraid to
They're a
ask for help.
nightmare.
I think
No,
that's
you've-
the biggest thing you can
You've got
say.
to, yeah.
Yeah,
You've got a problem. Somebody can help you solve it.
Brilliant.
And
And
don't be
that's
afraid of
a-
the treatment either. We might have had quite extreme side effects, but I spoke to a lot of people at the
Still
support
here.
group on Monday, and a lot of them kind of breeze through the treatment and are doing really, really well. So, don't be afraid of these things. I think they are there to help. And if you do have side effects, hopefully, they can be helped like they've helped us.
Somebody
Yeah.
can help you out, yeah.
Brilliant.
And take their advice. If
Absolutely.
they say stick your head in a bucket of ice water for an hour, that's what you've got to do. Because they know what they're at, don't they? Yeah.
Yeah. Well, yeah. Yeah.
I mean,
and
some of the things just aren't nice, are they?
no, they're not.
no,
they're
they're
not.
not,
And
no.
I think
But if it's going to
Help you, yeah.
help, then you've got to take their advice.
Yeah,
absolutely. And I think, sometimes, as I think Leslie, you said, or it was Doug, I can't remember. I'm having a moment. But you were talking about that worry about if you reported side effects, they might take you off the treatment. And then what does that mean?
Yeah.
When you've got limited treatment options. But actually, what we would say is report early, tell your oncologist, ring that number, to speak to the expert nurses, because the earlier the treatment starts for these side effects, the more likelihood it is that you might have a short break off treatment and then be able to restart. Don't wait until you're really ill. And I know sometimes on those cards they say things like oncology emergency helpline, but anything that is you not feeling you, to me, isn't worthy of calling that number.
Yeah.
And we would
Absolutely.
rather, as healthcare professionals, you ring that number and we said, oh, don't worry about that. That's absolutely fine. Just do X, Y, and Z, rather than you sit at home and then get really ill. So thank you for bringing that message. That was brilliant.
Yeah, don't ever think that you're going to be a burden on the NHS at all, because you're not. They're there to help.
Brilliant.
And don't worry if you are.
Yeah,
That's
yeah.
what-
Well, that's what
exactly.
we're here
That's
for.
what we're there
Yeah,
for.
exactly. Because if you don't,
Yeah.
then I used to say to
Yeah.
some of my lung cancer patients when they say, oh, we don't like to bother you, Rachel. And I said,
Yeah.
no, you've got to bother me.
Yeah.
Because if you don't bother me, I haven't got a job and a reason
Yeah.
for being. So just bother me.
Yeah.
That's absolutely fine. So with that, I'd just like to say thank you for joining us today. We hope you've found this very helpful to you and supportive. Thank you so much to Leslie and Doug for being, again, so honest and open about your own lived experiences. We do have an email address at breathestrong@hasag.co.uk. So please do write in, because as we start to think about the end of season 1 and we're looking for funding for season 2, we need to be able to demonstrate that this has been worthwhile. I mean, brilliant news. We've been downloaded in 25 countries worldwide. We've hit over 1,000 downloads, but in order to be able to get more funding, we do need to be able to have some of your views and thoughts about our podcast and what you'd like to see in the future for season 2. So on that note, just stay strong. Know you're not on your own. We are here. And thank you very much again for joining us. Thank you, Leslie. Thank you, Doug. And get well, Barbara.
Thank you.